Hello, my name is Dr. Tom Brannigan. I'd like to do a diabetes exam on you, if that's okay.
Okay.
What's your name?
I'm Luke.
Luke. Nice to meet you, Luke.
Hello.
So Luke, you're at 45 degrees. Could I get you to just lift up your t-shirt a little bit? And I'm just going to have a look at you from the end of the bed. Maybe you could pull up your shorts a little bit, pull the legs up. First, remember the general observations that apply to any system. Apply these specifically to the diabetes exam. Is the patient well or unwell? Comment on the patient's alertness, as dehydration, hypoglycemia and hyperglycemia can affect consciousness level. Comment on their colour, noting especially acanthosis nigricans, which has darkened, thickened skin in the body folds. Comment on the patient's weight, in particular any signs of recent weight loss or gain. Note the patient's hydration status. Is the patient breathing comfortably or are they dyspneic? Note Kussmaul's breathing if present. This is deep, laboured hyperventilation. Note any scars or bruises, especially around the abdomen or upper thighs, which can be secondary to insulin injection. Note any obvious endocrine facies, as certain conditions such as Cushing syndrome, acromegaly, Graves' disease, or hemochromatosis predispose patients to diabetes mellitus. Look for equipment or devices that are attached to or surrounding the patient, such as insulin pens, glucometer and strips, or an insulin pump. Note any medications around the bed. Note the location of the patient, and note any signs around the bed. As you approach the patient for closer inspection, check the axillae and neck for acanthosis nigricans. Offer to perform a lying and standing blood pressure to check for orthostatic hypotension. In practical terms, this is too lengthy a process to be done in an OSCE unless it were the sole function of the OSCE. I'm going to check your vision a little bit now. How's your vision been?
Good.
Okay, could you cover up one eye, please? Visual acuity is not formally tested in a diabetes exam, so it is not necessary to use a Snellen chart at 6 meters from the patient. You may use a pocket Snellen chart to ensure that the patient can see adequately through each eye. A common complication of diabetes mellitus is visual impairment due to cataracts or various retinal pathologies. Okay, that's perfect. Okay, so what I want you to do next is, if you could keep your head perfectly still, and if you could follow my finger with your eyes. Okay, I want you to tell me if at any point you see double. The motor components of the third, fourth and sixth cranial nerve are tested together. Make sure that the patient does not move their head, and make sure to instruct them to inform you if at any point they see double. Perfect. And next what I'd like to do is look into your eyes with this. Using the ophthalmoscope, assess for rubiosis, cataracts and retinal pathologies in each eye. Okay. I'll just check the other eye. Okay. Ask the patient to stick out their tongue and look at their mucous membranes to assess hydration status. Right. Perform a closer inspection of the abdomen and the upper thighs for bruising, fat atrophy or hypertrophy secondary to insulin injections. Palpate over these areas to feel for any lumps that may not be apparent on inspection. Perform a closer inspection of the legs. Okay. Now I'm going to have a little closer look at your legs and your feet. And I just need to look between each of your toes. Inspect between each of the toes for breaks in the skin. Now I just need to lift your leg up so I can see underneath. Make sure to lift up each leg to check for ulcers on the heels. I'm just going to check down your legs, check for the temperatures. Palpate for temperature along the legs using the dorsum of your fingers. Palpate any erythematous areas for warmth with the dorsum of your fingers. Okay. And now I'd like to check your pulses. I'm going to start with the pulses up here. The femoral pulses. Palpate the peripheral pulses of the lower limb. Start with the femoral artery. Okay. Okay. I'll check the pulses behind your knees next. I'll just get you to bend your knee. Move on next to the popliteal artery. Perfect. Check the other knee now. Okay. And now just check for the pulses down here. Palpate for posterior tibialis between the medial malleolus and heel. Move on to dorsalis pedis pulse. This is located lateral to extensor hallucis longus tendon, just distal to the dorsal surface of the navicular bone. Okay, I'm just going to squeeze your toe now. Check capillary refill time. This is normally less than 3 seconds. The other side. Okay, so the next thing I'd like to do is check for your sensation along the legs. So we have two types of sensation that we check for. There's light sensation and sharp sensation. So I'm just going to use a cotton bud for this. So just so you know what I'm about to do, this is what I'm going to put on your leg. Can you feel that?
I can.
And how does it feel to you?
It's soft.
It's soft, okay. So I'm just going to touch that at various points around your legs. If you could just say yes when you feel the cotton bud touching it, and let me know if it feels different on the left and the right.
Okay.
Okay, and I'll get you to close your eyes for this. Test for light sensation of each dermatome bilaterally.
Yes. Yes.
After every 2 to 3 dermatomes,
Yes.
ask if the left and the right feel the same.
Yes.
If sensory loss is detected, spend more time around that dermatome to define its borders.
Yes. Yes. Yes.
Okay. I'm going to go through the same again, only going to use this slightly sharper end, just so you know what it feels like. I'll just touch it off there. Did you feel that?
I did.
And how did it feel?
Pointy.
Pointy. Okay, so I'm going to just touch around the same spot. So I get you to close your eyes again. Just let me know when you feel it. Test for sharp sensation of each dermatome bilaterally.
Yes.
After every 2 to 3 dermatomes, ask again if the left and the right feel the same.
Yes. Yes.
If sensory loss is detected,
Yes.
spend more time around that dermatome to define its borders.
Yes. 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 Yes.
Now there's one other type of sensation that I want to check. So this is just a little plastic filament. So just tell me if you can feel this. The characteristic sensory loss in diabetes is in a stocking pattern. Test for vibration sensation using a 128 Hz tuning fork. The next thing I'd like to check for is your vibration sensation. So just so you know what it's going to feel like. Can you feel this?
Yes.
And can you feel when it stops?
I can.
You can, okay. After testing for vibration sensation at the sternum, Place the vibrating tuning fork on the bone of one of the distal interphalangeal joints. If the patient does not feel the vibration, move to a more proximal bony prominence, such as the metatarsal interphalangeal joints, the medial malleolus, or the knee. Ask the patient if they can feel the vibration and to tell you when it stops. So the next thing I'm going to do is check for your proprioception, so it's whether or not you can tell where things are in space. Okay, so I'll get you to close your eyes, and what I'm going to do is move your toe up and down. I want you to tell me, is it up or is it down? To test proprioception, take the distal interphalangeal joint of one of the patient's toes. Hold the side of the toe and move it up and down, asking the patient to tell you whether you stop with it pointing upwards or downwards.
Up. Down. Up.
Okay, and we'll do the same on the other side. So I'll just isolate this toe again. And up versus down. So just let me know. What's this?
Up. Down. Down. Up.
Okay. Next, check the reflexes in the lower limb. So I'm going to just check your reflexes around the leg as well. Prior to testing them, explain to the patient what you are about to do. Let me take the full weight. You don't try and support yourself at all. Ensure that the limb being tested is fully relaxed before attempting to elicit reflexes. Some patients may need to be told multiple times before they fully relax. When checking the patellar reflex, observe the quadriceps muscles for a flicker of movement. So now I'm going to put the heel of this leg onto the shin of this leg. It's a little bit uncomfortable, but try and find a spot that's comfy for you. Is that alright?
That's okay.
When checking the Achilles reflex, observe gastrocnemius for a flicker of movement. If you have difficulty eliciting a reflex, ensure that the patient is fully relaxed. Reposition yourself and try again. If you are still unable to elicit the reflex, employ a Jandrissic's reinforcement maneuver and try one more time. Report your findings at the end of this. That's great. Okay, Luke, thanks very much for that. That's everything.
Thank you, Doctor.
Thank you. Bye now.
Mrs. Chua, now we're going to move on to the pulmonary exam. Okay, for videotaping purposes, I'm going to have you move to the side here. Just swing your legs around this direction. Great. So that we can get a picture of the back. Okay? And I'm just going to open your gown in the back. Now, first we're just going to do a general inspection of the skin, looking for any lesions, noting respirations, AP dimension, and also lung expansion. Have you breathe in and out, and again, in and out. Good. Okay. Next I'm going to palpate for any tenderness along the spinous processes. Okay? And along the ribs. Okay? Next we'll percuss the lung fields. Posterior and lateral. Okay, and then percuss the spinous processes and the CVAs. Okay? Next I'm going to auscultate the lung fields. When you feel my stethoscope on your back, just take a nice breath in and out through your mouth, okay? Okay, now we'll look at the anterior chest. I'm just going to have you drop your gown just a little bit there so we can see the anterior chest. Great. And again, I'm looking at the skin for any lesions, any signs of retractions, and also noting the AP diameter when you're breathing in. Then I'm going to palpate for any tenderness along the clavicles, sternum, and anterior ribs. Okay. And then I'm just going to have you pull your gown up just to underneath your breasts. Right, so I can palpate your lower ribs. Good. No tenderness there. All right. We'll go ahead and percuss the lung fields. Again, pull your gown up for me. Great. Good. And now I'm going to auscultate the lung fields. Again, just take a nice breath in and out when you feel my stethoscope. Just have you pull your gown up. Good. Excellent. Okay.